The Center for Health Policy has hosted 3 trips to Africa with congressional staff. Actually, the first one was to Zambia in 2010. And one of the really interesting things about this trip is to see how much progress has been made in Zambia just since 2010. CIDRS, and I think PEPFAR at large, has done an extraordinary job at training and mentoring Zambians and South Africans to take care of their own. I mean, we met wonderful physicians and nurses, many of whom had had some training in the U.S., who are now being primed to take over whole healthcare centers and lead the delivery of care to their own people.
The challenges that are most marked are around human resources and the need to maintain high ratios of staff in these clinics to ensure that we're able to grow and meet the needs that are in front of the clinics, but also to ensure quality is continually met in service delivery.
I think the big one is just the fragility of the healthcare system at large. The constant stockouts of even basic equipment like sutures. And most notably on this trip, the fact that the electricity went out while we were there. And that had an impact on everything. South Africa is a country where a meaningful response to the epidemic came so late, after hundreds of thousands of people had died, and TB and HIV had spread exponentially.
The talk about providing South Africa with technical support is one thing that really is a bit concerning, because we're not so sure what it really means.
The majority of the South Africans, especially the African people, 80%, according to the statistics, they say 80% of our people consult traditional health systems.
If the funding from PEPFAR stops, we are going to be seeing a lot of decline in sensitized services that are MSM friendly.
It's hard to wrap your head around what it means to have 6 million people with HIV infection. So notwithstanding a much better infrastructure than the rest of Africa and more healthcare personnel, HIV and tuberculosis continue to overwhelm the healthcare system in South Africa. I think with the best intentions, it's going to take them a number of years to get a grip on that, and that U.S. and global fund support are going to be vital in the interim.